Welcome to Peconic Bay Medical Center. My name is Amy Loeb. I am the Executive Director here. As a result of a local farmer having a heart attack and the community coming together 70 years ago to create this hospital, it has become a regional medical center. It's really a wonderful story, and it continues to grow and blossom.
Peconic Bay Medical Center is located in Riverhead, Long Island. Coming out here, my eyes were definitely open to how diverse this community is.
Everyone is connected to this community. You feel like you're part of it immediately.
Since I've been here almost 11 years now, I've seen the changes. I've seen us keeping more of our patients out here.
Just being, a young doctor and being part of a place that has so much growth and still has so much more to expand to has been really great at this point.
The birth of graduate medical education at Peconic Bay actually happened in 2010, and then in 2016, our hospital became part of Northwell Health.
All of these changes to our program have allowed for tremendous growth. Our residents can now rotate across multiple hospitals and multiple urgent care facilities. Another asset to our program is Northwell's Center for Learning and Innovation, also known as CLI. It's a large facility that provides training for all of Northwell's employees. More specifically for our residents, it provides patient simulation labs and courses in business development. Another huge part of that is our BioSkills facility, and this has procedural training courses for our residents. They cover our suturing, IUD placement, skin procedures, thoracentesis, paracentesis, and joint injections. Another favorite course at CLI is the point-of-care ultrasound course, and so we are able to practice this ultrasound further at our continuity of care practice. Welcome to 34 Commerce. This is our resident continuity of care practice. This is where the residents come to see their patients. It's located just a few miles from the hospital. It's really a home base for them.
The patients I see in the hospital, I get to follow up with in clinic, and that makes the continuity of care great because I don't have to go through their history. I don't have to bore them with all of that stuff. I feel like the patients are more comfortable that way, and they get used to me being their primary care doctor.
So here we have one of the resident workspaces. As you can see, it has laptops for each resident. The residents are also given a laptop of their own for the duration of their 3 years of residency. And here we have our second resident space. It also has laptops and desktops for the residents. This clinic has 13 patient examination rooms. We practice the full scope of family medicine here, including pediatrics, obstetrics and gynecology, and OMT. So as you can see, this is one of our pediatric rooms. We have all sorts of equipment for peds. It also has a flat bed for osteopathic manipulative treatment. This is one of our specialized GYN procedure rooms. Due to our facilities here, we're able to practice colposcopies, PAPs, IUD insertion, and maternity care.
Welcome to the Corey Critical Care Pavilion. We are a level 3 trauma center. When we began the COVID crisis here at Peconic Bay, we literally had just opened this building, and we were able to care for those patients in our ICU, state-of-the-art, all negative pressure, and we were able to provide care that was truly patient-centered. This is a 60,000 square foot building, which was dedicated just in 2020. Our community stands behind this hospital with regard to philanthropy in a way that I've never seen in my career, and it's really very special. Everyone owns this hospital together.
We do have a helipad on the new Corey Critical Care Pavilion, and we can get them to the western part of Long Island in 15 minutes. We can get them to our sister hospital, Southside Hospital, in around 10 minutes. And then we do have ground ambulances.
We see, believe it or not, 38,000 patients every year here in this department. So it's a busy emergency department. We service 400 square miles and 200,000 community members here at this hospital. So this emergency department is very important to this community.
Here, I realized that there are so many people interested in research. I think clinical research helps move medicine forward. I have a strong interest in it. Peconic really, and the Northwell system was open to finding a place for me in the academic world. What made Peconic different is they never put me in a box or a bubble. They said I could try many different things while I'm here. They encourage that. It offers room for growth, opportunity, and everybody here is always open to exploring those with you. Scholarly activity or research and quality improvement have become fundamentals of all residencies across the country. We've developed a robust program here with a didactic series in research and allowing the residents to develop and execute their own research projects. I work closely with the residents to develop their projects and help them present and publish. This year we won regional conferences for our posters, and they've been accepted nationally at the AAFP FMX conference and the STFM conference.
One of the reasons I wanted to come to Peconic Bay Medical Center is because it's part of the Northwell system and the fact that it has multiple tracks.
These tracks offer specialized courses, conferences, and trainings in the various specialties that people like to go into. The tracks that we offer here are global health, women's health, quality leadership and advocacy, urgent care, clinical informatics, urology, and hospital medicine. And tracks are geared towards people who want to go into a fellowship offered by family medicine. Northwell itself offers our family medicine residents fellowships in ENT, sports medicine, urology, health administration, and geriatric medicine. Those that do not want to participate in tracks can also participate in electives in any of the specialties.
I think my expectations were met and kind of superseded as well. I've learned a tremendous amount of information with the track that I've been a part of and had great experiences with doing procedures with a lot of the attendings that I've worked with.
I really guarantee a strong general medicine training. It's you and the attending together. And there's no fellows, there's no other co-residents you're competing with for procedures or for experience.
Our program directors are very approachable. They have an open door policy, and I, as well as my fellow residents, feel very comfortable with going to our program directors to discuss any issues that might come up.
We have monthly program director meetings where we bring up concerns that we have, and all those concerns are always addressed in a timely fashion. We've been afforded the opportunity to have 4 wellness days in addition to our vacation time that we have. And you could use those wellness days at any point throughout the year for your own well-being.
We understand that they're people and life comes with hardships no matter what your profession is. We do whatever we can to accommodate their needs and make it so that they can tend to the needs of themselves and their families as well.
All the residents, the TYs, all 3 years of the family medicine program get along really, really well.
We're a very tight-knit group, and we do a lot of social events that help support that feeling. Some things that we've done in the past are apple picking, pumpkin carving. We also used to do, before the pandemic, dinner every Thursday night after medicine, and I look forward to doing that again. We're definitely a family in the hospital, and you get to know everyone that you work with very closely.
What helped us get through the pandemic was having each other and having each other to rely on, and having the support of the residents and also the attendings. And I think that's what makes this program so wonderful, and I love being part of it because we're all friends and we're all family.
10 years ago, when I rotated as a medical student, experience was very personalized. It was one-on-one with the attending, where I got to pick the mind of the attending and ask any question on any aspect of patient care. That culture is still a huge priority for us, is to personalize education and still have that one-on-one mentor relationship between the resident and the attending physician.
I definitely have a sense of pride being part of Peconic Bay Medical Center Family Medicine Residency. It's been a great experience since I've been here, and just to know all the resources and opportunities that I have moving forward.
Thank you for taking the tour of Peconic Bay Medical Center with us today. We can't wait to meet you. And the real question is, are you made for this?